Oh, there we go. Now I'm on stage. Now I'm here. I'm excited to be here with you today. I'm at a different location than usual. I'm actually at my dental office. In fact, makes me wonder if I shouldn't do a little walk around while we're here. We'll see. I'm usually not here at the dental practice on Thursday at 11 a.m. But today I had some things that I needed to be here for. So here I am at the dental practice. And a couple of the things that I'll start off with this until we get questions going. A couple of the things that I am doing here today is bringing, well, a lot of fun things. I brought some things. I brought the new floss, which should be on the website, I'm hopeful, today. And also the tongue scrapers, which we are selling out of so quickly. I just had to place an order to China. And get this, who knew? But China literally closes down for a month for the Chinese holidays. I didn't know this. Who knew? Who knew this? Anyway, so the tongue scrapers are phenomenal. They're copper tongue scrapers. The floss is absolutely amazing. It's bamboo charcoal floss. So check out both of those. I just brought those here to the dental office because we have people that are wanting them here. But the second thing I was here for is we have been vetting today a new pediatric dentist. And I'm so excited for her. Excited for her, first of all, because she's great. And I think she's going to be a great fit for our practice here. But what we're going to be doing with her is we are really establishing new protocols for pediatric dentistry, for health-based pediatric dentistry. And we are working to change the paradigm of what this looks like. And it was kind of funny. We were just talking with my partner and I, we're just talking with one of our doctors that does the work with sleep and airway and jaws and things for an adult. And she was just joking. And she said, we're going to put you out of business. We're going to fix everybody when they're kids so they never have issues when they're adults. And I always say, I don't even think like that because there are so many people that need help. We will never run out of people to help. But how amazing is that? If we could predict and we could take care of growth and development and airway issues so that a child never has to have ADHD that's related to sleep issues. They never have to have focus problems. They never have to have headaches. They never have to have diminished less growth because they're not getting the air they need while they're growing. They never have to have the headaches, the jaw pain, the sleepless nights that their parents are dealing with because we fix it while they're young. I mean, this is the stuff that just lights me up and gets me so excited. So we had a doctor that was doing a working interview today, and she was amazing. We can't wait. We already have a pediatric department here at our office, but we're going to really be expanding it up. In fact, my partner was cracking me up. She said she feels like she's at one of those splash pads, where the water shoots up, and she's got like a foot on this spout and a hand on this spout and a hand on this one, and we're just holding all the spouts because the demand for this kind of health-based dentistry for pediatrics is absolutely out of control. But we can't take care of any of it, so we're holding our hands on all these spouts, just ready to take our hands off, and this doctor is going to help us be able to do that. So in doing that, we will be able to share more information about pediatric dentistry and how do we help prevent things before they even start. So super excited there. All right, let's, it looks like we got some questions coming in, so I will start going through these. Can you talk about tinnitus and oral health? All right, so what people don't often realize when you just look at the anatomy here, there's your ear and there's your jaw joint. So open and close, you'll feel there's the jaw joint right there. It is literally right next to the ear canal. So if there are issues with the way the teeth line up, and some of these things are post braces. So orthodontics, really their goal is to make the teeth look right. Well, it doesn't, most of the time it works out okay, but sometimes where they look right, they don't actually function the best. So you get the teeth and the jaw being pushed backward. We call it being posterior, pushed backward. Well, if it's pushed backward, it's pushed right into that jaw, or right into that ear, right into that ear. Is the teeth wear. Sometimes they'll wear off because they'll bring the jaw forward to try to get more air, and you wear the teeth off. As they wear, it sinks the bite even in further. And as the bite sinks in further, it pushes these jaw joints back into those ears. So a lot of times there is a connection between bite, teeth wear, teeth position, even where they were positioned with braces, and ears, which is ringing in the ears, which is ear pain, a lot of different things. We can't always alleviate it. There's multifactorial things that go along with it, but a lot of times it's inflammation based as well. And if there's infection in here, then it can cause inflammation in all of these structures back here. So you're going to show up with ear ringing, ear pain, ear problems from inflammation if there's infection underneath old root canals where you had wisdom teeth removed. So there's actually a huge connection between ears and jaws and teeth. They're all right here in the same place. All right, I'm going to jump over to these Instagram questions. I noticed that two of the ingredients in the gut soothe is xylitol and mannitol. How will those ingredients affect my stomach when striving to eat low FODMAP foods? So it's interesting. The reason that we're using those two things is, there we go. The reason we're using those two things is they're prebiotics. So they actually help to feed the bacteria in the gut, but they also help to soothe. The xylitol is it's a sweetener, and so it does help with the taste of it. It's a licorice-based, so diglycerated licorice. So it's licorice-based, which is the natural soother. Actually, there's a lot of research talking about licorice. Xylitol also helps to feed good bacteria that are there and help support good bacterial function. That's one of the main purposes of them for them there is a prebiotic, basically prebiotic, and as a sweetener to make it so it's more palatable from a chewing standpoint. The more you chew a product, if you take it as a powder or a chewable, you're actually going to get action quicker than if you take a pill. So I really didn't want this to be pill form. I wanted this to be chewable form. So that's the reason those two things happened. They don't ferment, actually. Xylitol doesn't ferment. So if you're looking at, low FODMAPs, you're wanting to decrease that fermentation, it's going to soothe everything. It's going to soothe that fermentation. So good questions. I like that. I'm going to do a little research on mannitol, actually, because I've never had that question before, on exactly how mannitol affects that FODMAP issue. Good question. Well, on Christopher's cleanse, I began using the Living Well HCl and added in pure brown digestive enzymes. Is there a Living Well digestive enzyme? Great question. So actually, the HCl Digest has an enzyme with it. Do I have it right here? Aha! Look, I never have it here. Yep. HCl Digest is actually hydrochloric acid or betaine hydrochloride and pepsin. So the pepsin is the digestive enzyme, so it actually has an enzyme with it. You can add another enzyme if you would like, but this actually has enzymatic activity with it. So it should work for both. Is there a reason for deep cracks in our very back teeth as adults? Well, teeth naturally have grooves, right? They have pits. We call them pits and fissures in the top surface of the tooth. That's just the way the tooth develops. And honestly, it's so that we can chew food. We need those kind of grooves and things for the food to get in and be able to really chew efficiently. So if you're talking about just those regular, grooves, that's just the way the tooth develops. Now, if you're getting deeper cracks in your teeth as adults, most likely that's because of function issues, because the teeth aren't lining up properly. And so let's say the top cusps are actually creating a groove. And often it's based on if you're moving your bottom jaw forward or in other ways to try to get more air at night, it will create sometimes these deep fissures. It's kind of like the idea of glaciers that are moving down mountains and valleys and creating these huge valleys. Well, teeth will do this if you're having to move them in odd ways to get enough air. So look and see if there's an airway issue. Any plans for a toothpaste that's not a powder? I find it very messy, especially the charcoal. Funny you ask. Literally right now, I'm formulating a toothpaste and I'm adding all the things I don't want. So, making sure we're not including the things I don't want. I don't want glycerin. I don't want a bunch of things. So it's a little bit challenging. But this is going to be a multifunction toothpaste. So it's going to have hydroxyapatite, but it's also going to have probiotics. So it's going to help gut health, gum health, and tooth health all at the same time. Can't wait, literally in formulation in my kitchen right now. This is how I formulate everything. I actually don't have formulators do it for me. I formulate it myself. I'm a cook, which I think helps because I kind of get ingredients, but I'm using crazy things like Irish moss. Well, I don't really cook with Irish moss, but I am making a toothpaste out of it. So yes, coming soon. Thoughts on desmoplastic ameloblastoma? I'm going to have to do some research on desmoplastic ameloblastoma. Ameloblastoma is going to be something that's affecting the tooth, basically the tooth bud and the way the tooth bud grows. I don't know desmoplastic. So just looking at the word there, it would mean something is going on with the growth and development of that the cells that form enamel. Is what that sounds like. So I apologize. I'm going to have to do a little bit of research on that one. We will get you more information. In fact, Kathleen's on here. Kathleen, if you make a note of that, and we can get back to them on information there. Your thoughts on crown lengthening, okay or not okay? All right. Crown lengthening. What the heck is crown lengthening? Well, the crown of the tooth is the part you see. The root of the tooth is the part that should be underneath the gums. If you've had a crack, a cavity, something like that extends all the way past the junction between the crown and the root if it's extended onto the root. The problem is that gums need a certain amount. They need 2 millimeters of healthy tooth to connect to in order to keep the gum healthy. So let's say that your cavity extended a millimeter onto the root. Well, now the gum is going to have to move down another millimeter in order to make there enough tooth here to connect to that's healthy. What crown lengthening is we speed up the process. Rather than the body being inflamed and destroying bone and gum in the area and making that space, then we make the space. So we remove bone so that and remove bone and gum and position it up higher on the root surface so there's room above it. Pros and cons. It means there's less bone supporting the tooth. There's less gum supporting the tooth. However, it enables you to keep a tooth. If the tooth is alive, meaning it's not had a root canal, the tooth is alive, if it's savable, then I think crown lengthening is a viable thing to do. I will tell you that the tooth may be on a long, slow decline, and it may be that you're going to end up losing that tooth. But if you can gain another 15, 20 years out of it, then I think it's definitely worth it. If the tooth is at a root canal, my answer is going to be very different. Most likely that tooth is very infected underneath. And so I'm going to recommend that tooth be removed and you replace it rather than removing more bone, because when you remove more bone, it actually makes it less possible to do a dental implant, because a dental implant needs bone. So the tooth is going to be removed anyway. You remove it now, preserve the bone to be able to place a dental implant. But if the tooth is alive and you're going to keep the tooth, then a crown lengthening is okay, knowing I may lose the tooth in the future. I may need to do bone grafting in the future to rebuild the site for a dental implant. So it's pros and cons. You just have to weigh where you're at. What's the best way to treat and heal a bad cavity that dentist wants a root canal for? How to balance the pH in your mouth. Okay, so if a dentist tells you you need a root canal, the key is the tooth still alive? That's the key. If it's still sensitive, if it still hurts when you tap it, or if you still feel it, and usually that tooth's still alive, and the dentist can determine if it's still alive. If it's still alive, then what we do is we remove the cavity all the way down to the deepest part. Then we use ozone right over that deepest part and fill right over top of it and keep the tooth alive rather than doing a root canal. If the tooth is already dead, I recommend removing the tooth and replacing it. So it's root canal or removing it if it's already dead. You've pretty much, there's no point of return at that point. You can't keep the tooth alive if it's already dead. So that's the deciding point. There's nothing you can do at home if that cavity is that deep. You need to have it dentally treated if it's that deep. How do you balance the pH in your mouth? Well, that's going to be you thinking very strategically about not having as much acid. So you're going to just decrease the acid content in your mouth. You're going to decrease how much is going on in the mouth. And from a food standpoint, you can also alkalize the mouth with the Gut Soothe product. I don't think that one is in here. It's not. The Gut Soothe product does alkalize everything. pH in your mouth is really based more on what you're eating and the frequency of eating. So if you're eating every 20 minutes, every hour and a half, you're going to you're going to make your mouth more acidic, because every time you add food, the acid content is going to increase to digest the food. But if you space your food out longer, 3, 4, 5 hours between eating, your mouth is going to balance and be a lot more alkaline between those eating periods. This goes for drinking too. And you have to think about lemon juice, sodas, anything that's acidic will change the pH in your mouth. What about other products you would recommend to replace Listerine to combat plaque and gingivitis? Or what other product? Absolutely my mouthwash. If you have not looked at my mouthwash, you are going to love this. I love this mouthwash. I will never use anything else again. What is it? It's a combination of hydroxyapatite, so it's going to remineralize teeth, but I actually put a whole bunch of herbals in here. I have plantain, and not plantain like the banana, plantain like the green leaf. I have to think of all of them now. It is marshmallow root, which is very good for dry mouth, for sensitive gums. It has lavender, which is very anti-inflammatory. Calendula, which is it's called pot marigold or calendula. Calendula is very good for gum health and inflammation as well. So it has a whole bunch of herbals to keep the mouth healthy. And it has colloidal silver, which is the base, and that is going to keep bad bacteria at bay. So it's a combination of all of those things. 100% wouldn't use any other product but that. Can I rebuild my dentin or enamel that is translucent on my 2 front teeth? It's just on the bottom of my 2 front teeth. Well, first of all, if it's on the bottom of your 2 front teeth, most likely it's because you're bringing your bottom jaw forward against those 2 front teeth to try to get more air. So look at the back side. If it's thinning, then you need to figure out, why is it thinning? Most likely this is tooth function that's causing that thinning. If that's the case, you need to get to root cause. If it's just because, you've had some tooth wear because of acid in your mouth, whatever it might be, then absolutely the tooth powder will help that. So tooth powder is hydroxyapatite. The hydroxyapatite is what will rebuild the enamel. So give it a try. But in your case, I would suspect that there's probably an airway issue going on. That's the factor or the root cause to that. Just recently watched your video on sinus problems caused by a failing root canal. I have a similar issue, not necessarily a detrimental sinus issue, but I have had Bell's palsy for about 6 months after. Oh, I'm sorry. That's so frustrating. There's so much infection that goes on around the roots of especially top root canals. There are 3 to 4 roots in those top teeth. It's the most difficult root canal to do, which is an upper first molar. The upper second molar is close second. Those are the most difficult teeth to do root canals. And as we know, as I've taught, it doesn't matter how well it was done. I mean, it could be the best root canal in the history of mankind, and it's still not able to completely clean that tooth. So then it requires your immune system to work hard to keep it clean. And who knows what happens if that immune system is so taxed? Could it be Bell's palsy? It's hard to, I never will say, yes, X plus Y equals Z. Yes, the root canal caused you Bell's palsy, but I would suspect that there's definitely a factor there. How can we heal the infection on the ear? Well, the first key is going to figure out where's the infection. Is it underneath an old root canal back here? Is it in an old wisdom tooth cleanup area? All of those can be found on a cone beam CT scan. So that's the first place to start, is to find out what is the infection. I bought some hydroxyapatite powder with calcium carbonate and asked for the detailed ingredients, and it showed fluoride, lead, and cadmium, but no calcium carbonate. I don't know which calcium carbonate you're talking about. If it has detailed ingredients, mine doesn't have any fluoride, lead, or cadmium. I'm guessing maybe they gave you some trace minerals from the bentonite clay. They may have had a bentonite clay in that product. That's all I can think of, because calcium carbonate is usually from shells. It's ground up seashells. It's just a calcium carbonate product. So it shouldn't have any of those other things in there. Would constant sinus stuffiness be caused by a bad cavity? It would be caused by a dead tooth, a dead or reinfected tooth. So if a tooth is dying, dead, or if it has had a root canal and it's reinfected, it absolutely will cause sinus issues. I've been wearing a night guard for 3 years for grinding and TMJ. My gums are starting to hurt and swell. Is it from the night guard? Very possibly. And possibly there's a lot of bacteria that those night guards harbor. There's new cleaning techniques that you can get. There's ultrasonic cleaners that you can put those night guards in. I recommend using colloidal silver. So I use a little bit of the mouthwash and some water with one of those ultrasonic cleaners to just get everything out of that mouth guard. That may be part of the problem, but it also may be that it's just pushing on the gums. I actually don't recommend long-term use of TMJ appliances, because we try to get to the root of why are you grinding, and we fix that so then you don't have to wear a long-term appliance. So it might be worth doing a cone beam CT scan and figuring out, do you have airway issues? Is that why you're grinding? That's actually the most common reason. My dentist told me 29 is rotated third clockwise. Why would that be? So 29 is this tooth right here. No, this side, sorry. This side right here. That's tooth number 29. If it's rotated a third clockwise, who knows why it's rotated? It may just have been that it came in that way. I have a tooth. Which one is it? I think it's right up here. That's absolutely turned kind of sideways. It's just the way it grew in. So it may be that yours just grew in that way. It may also be that it's wearing funny because of the way it hits the tooth above it. What causes pineal gland calcification? So the most common implication for that is fluoride usage. So usage of fluoride in tooth care products, but also in water. It's in so many different things. It's in anything that was made with fluoridated water. So any packaged food that actually had water in the manufacturer may have also incorporated fluoride into it. That's the most common reason. We also find it if you're low oxygenating. So you're not getting enough oxygen at night. We often find a lot of pineal calcification. The correlation is kind of an interesting one to try to figure out. But I believe what's happening is the body is literally in fight or flight mode. It's not absorbing and digesting minerals properly. And so everything is calcifying. So we need to get oxygen levels up so that kind of calcification can go down. But if you send an email to smiles at it's going to be smiles@totalcaredental.com. So smiles@totalcaredental.com, and ask for the pineal decalcification protocol. We're happy to share that with you. So smiles@totalcaredental.com, and we can tell you how to decalcify that pineal gland. I work in oral surgery. Can you explain removing the periodontal ligament? Yeah, great question. So Any dentist and your oral surgeon will know that there is a periodontal ligament. It's the connection between the body and the tooth. And I think of it kind of like this, like bungee cords that the tooth is suspended in. So what we do when we remove the ligament is we literally take a burr and we go around the socket. You're in oral surgery, so once you take a tooth out, there's a socket in there. We remove the soft tissue in the socket. So we use a burr to do that, to remove that soft tissue in the socket so that the ligament isn't left behind. I started having a tooth hurting after 4 days of oil pulling. Why would that happen? Very interesting. Great question. Oil pulling is going to balance and manage bacteria in the mouth. So that makes me wonder if you don't have some sort of a gum issue that you've stirred up a little bit with oil pulling. So I suspect it's gums. I would do hydroxyapatite, honestly, is the thing I would do in that area to see if you can't desensitize and maybe remineralize an area. Maybe you're pulling some things off of a tooth that's had some gum recession, an area that's prone to sensitivity. So I would try the sensitive tooth powder and see if that'll help. If you have low vitamin D and magnesium in your body, can the hydroxyapatite cause potential kidney and or gallstones? Well, ideally, you're going to increase vitamin D and magnesium. I actually recommend doing this along with my tooth and bone formula. So if you're working to remineralize teeth, I recommend that the tooth and bone formula, I again don't think I have one in here, but tooth and bone formula has vitamin D and magnesium in it. So it's going to increase the levels of both of those so that you can get better absorption. But the answer is really no, because hydroxyapatite, the form that we use, it dissolves in stomach acid. So if you are digesting or ingesting any, which you're going to no matter what, if you're ingesting that hydroxyapatite, it's going to dissolve once it hits the stomach acid and break apart into calcium, magnesium, phosphate. There's a whole bunch of different mineral ions that it will break apart into. It actually doesn't go full, as like a full hydroxyapatite particle past the stomach acid. If you remove a root canal tooth, can you put in a replacement in immediately? Can it wait? So the question is, if you take a tooth out, when does the implant go in? Well, this is a little bit dependent on the situation. So if you have a root canal tooth and there's not a lot of bone around it because quite a bit of bone has been destroyed from infection, well, the problem is a dental implant is like a screw in a piece of wood. So if you imagine your piece of wood like this, the screw has to have enough wood on either side to be able to put that screw in, and it has to have enough to anchor it properly. So if you've lost a lot of bone because of infection, there's not enough bone in the area to actually anchor an implant properly. So in our office, because we really want it to succeed the first time around, most people do, but we really are on the same team with you in that one, we typically remove the tooth, let it heal for 3 months. We do some bone grafting in the area, let it heal for 3 months, and then place the dental implant. So there's enough bone for that bone to grow, enough bone to grow to the implant and really stabilize it. And can it wait? Absolutely, it can wait. We should wait. We usually have it wait for about 3 months, but we also don't want to wait longer than about 6 months because you're going to lose a lot of bone after a tooth has been removed. And so 6 months to a year out, you're going to have lost quite a bit of bone. We can always rebuild it. That's no problem. But ideally, you're going to get that implant placed about 3 to 6 months after the tooth is removed. I'm a 70-year-old. My dentist told me I have a cavity between my molars. Can I heal the cavity? It depends on how deep it is. If the cavity is still in the enamel layer, then absolutely you can heal it. You're going to work with the tooth powder and you're going to brush with the tooth powder. You're going to take some floss and push that hydroxyapatite down in between those teeth so that you can get in between there. And you're also going to do the remineralization supplements, the tooth and bone formula and the vitamin D so that you can get it where it needs to go. Are mouthpieces for sleep apnea good? That's a loaded question. There's a longer answer that I can probably give right now on that one. Basically, what an appliance for sleep apnea does typically, and again, there's so many on the market, it's hard to generalize this answer, but a lot of them, what they're going to do is hold the bottom jaw forward. Now, structurally, this makes a lot of sense because if you're moving this whole jaw forward along with the tongue and other things that are in the way, those are often what's causing the sleep apnea. However, if you hold them forward over long term, night after night after night after night, the problem is it creates ligament laxity in this joint. And so the ligament and the cartilage in that joint don't stay in place nearly as well. And research is showing that after 4 years of continuous use of these, they're called mandibular advancement devices, basically something that holds your jaw forward. After 4 years of wearing that, it creates irreparable changes in the jaw joint itself. I don't love that. So what we actually do is, again, find root cause. Rather than just holding the jaw forward, we say, gosh, should the jaw be bigger? Should we actually make your mouth a little bit bigger to hold everything? Or do you have infection that's causing swelling back there? Or does your tongue sit too far back? Do we need to train it to come up and forward and clip a tongue tie so it can? So we look for root cause so that you don't have to wear that appliance long term and cause jaw joint damage. Can silent reflux while sleeping eat away at the molar enamel? Absolutely, it can. So silent reflux is basically acid coming up. But here's the tip about this. That was funny. My necklace flew funny. Anyway, here's the tip. A lot of times it's due to low stomach acid. So go do the baking soda test. Go check it out. livingwellwithdrmichelle.com. You're going to see the gut assessment on there. Go take it. Go do the baking soda test. Most likely you have too little stomach acid, and you need to increase that to be able to decrease that silent reflux. But that's one of the most damaging times is at night, because the acid comes up, it pools on the teeth. In fact, I can usually tell what side you're sleeping on because I'm going to see more erosion on the side you lay on. I always lay on the right side. Yep, I can tell because the whole front surface of the right side of the teeth have been eaten away. Yeah, it's pretty obvious. I feel like my teeth are shifting and my bite is off from an ill-fitting crown. Could a retainer help them from moving more? Yes, but I would just say, instead of doing that, instead of holding the teeth in a place that they don't really like, let's get that ill-fitting crown fitting better. So you can have it adjusted so that things can actually fit better with the bite. That's what I would do instead. If you have an airway problem, what kind of doctor should you see to correct it? I'm not in the US. So here you're going to see a dentist that focuses on sleep and airway treatment. There, perhaps an ENT, an ear, nose, and throat. Again, I don't know what the specialties are where you are, but it is in the dentist's domain here in the US. So I would search and see if you have somebody that is a dentist, dental trained, that could help you there as well. Dentist removed two of my husband's molars and did bone grafting. Do you think he should get implants, or do you not agree with them? No, I'm absolutely in love with implants. A huge fan. I like ceramic dental implants. So see if you can find someone who will place ceramic dental implants for him. Can sinus lift cause sinus infection? So what is a sinus lift? First of all, it's when the sinuses have dropped where you've had a tooth removed, or if the sinuses were already low and you had a tooth removed, you don't have enough bone left to actually put an implant back in. So the sinus lift lifts the sinus up and allows more bone to put an implant in. Can it cause a sinus infection? If it hasn't healed properly, yes. So that's going to be the deciding factor. Just the procedure itself should be very successful and won't cause an infection. But if that bone or any of the things that they put in there are infected, then it could cause an infection or lead to one. Does a CT scan show what an X-ray doesn't? Only about 10 billion things an X-ray doesn't. A CT scan is an X-ray, obviously, but it's a 3D X-ray. So a cone beam CT scan is going to show everything in 3 dimensions. And it has about 5,000 slices that I can go through. So I can see tiny little pieces of information on every single tooth. I can see so much more than I could ever see on a dental X-ray. It's just not even the same. It's like watching an old black and white movie from 1950 and watching the most state-of-the-art movie today. There is such a difference. It's like not even the same technology, not even the same thing. I did the baking soda and didn't burp. What should I do now? If you didn't burp with a baking soda test, you need to start supplementing with betaine hydrochloride. So HCL Digest on my site, you need to start supplementing with every meal and every supplement, and then start rebuilding the gut. Again, go on, take the gut health assessment. It's going to walk you through all of this. When getting a cleaning, is it okay to get ultrasonic cleanings or manual by the hygienist? Ultrasonic cleanings are fabulous. What they're going to do is they're just going to a little bit more gently remove all that debris and tartar. So I love ultrasonic cleanings. Go for it. All right, let's jump back on here. I'm going to finish up the last ones, as many as I can get in about 5 minutes. Okay. I am finishing my first month of your 3 steps to digestive health repair. Just ordered another month's worth of gut health and gut repair. My question, when do I start the Gut Well capsules? Do I start them now? Yes. If you are a month in, yes, you're going to start the Gut Well capsules now. Love it. Love that you're following along with the protocol, and it's going to work. I cannot believe the stories people tell me about how much better their gut feels. Okay, but then this next question is a good one. How do I know when to stop the gut health and gut repair? So I would do a month of all 3. Then I would just go to Gut Well and I would do the baking soda test again and see what's showing up and how are symptoms going. So another month of gut health and gut repair along with the Gut Well, and then stop next month and see how you're doing. Looking for alternatives to anesthetics for extraction and cavitation surgery. All right, there's a lot of talk about this one. So a lot of talk about graphene oxide and other things that are in anesthetics. What I have found is there is a brand called OraBlock. So OraBlock. You can ask your dentist about this. that was not manufactured the same place that a lot of the others were. And as I know so far, it does not have the graphene oxide in it. Now, what is graphene oxide doing in anesthetics? Well, what it does is it helps hold the anesthetic in place longer, so it makes the anesthetic work longer. So this is a benefit. If you don't want to feel the dental work, it's a benefit. But I know people are very concerned about the graphene oxide. So AuraBlock is one that doesn't have it. Do all the others have it? I don't know. This is all emerging research right now. So AuraBlock is what you're going to look for. And typically, if you can find one that's, like, we call it plain, which means it doesn't have epinephrine in it, that's going to be your best option. Okay, thick, bloody, slimy mucus dangling from the extracted and stem cells treated site. Curious what it is. What that's going to be is what's called the PRF. That's the stem cells. So that is actually, it's a fibrin plug, and that's what holds the stem cells in place. So gently push it back up in there. That should stay in place. Okay, what causes dental divots, tooth cupping? Would any of your dental products help with this? Most likely it's probably tooth wear. Divots and cupping is wear and erosion. So that's acid. Go do the baking soda test, and it's wear. You need to figure out what's going on with the bite. I know a couple of my front teeth. Sorry, I'm going to read it over here because it's too long. I know a couple of my front teeth that dentists removed hit the sinuses. My primary doctor hasn't heard of the cone beam scan. I've been suffering since all the teeth were removed. I'm so sorry to hear this. Yes, you're going to need to find somebody that can do a cone beam scan. So that's the challenge. You're going to need to find somebody that can do it. It's usually an oral surgeon, and there should be one in every, municipality, every larger area. Cone beam scan will be an oral surgeon. An endodontist often will have a cone beam scan, and you need to find out what's going on, and the cone beam really shows it. Can you explain why cavitations can cause so many issues? Yeah, it's interesting. A cavitation is an area that didn't heal right after a tooth was removed. And I was just at a course a couple of weekends ago learning even the latest research on this. What we're finding is it's dead necrotic tissue. It's like gangrene. It's dead tissue, and the dead tissue always attracts bacteria. So first of all, you're getting bugs in there, but that dead necrotic tissue is very irritating to the body. So what happens is the body's immune system kicks in, and it delivers something called Rontes, which is its own immune fighter. I kind of think of it as the guy with the machine gun. Rontes comes to the rescue. And unfortunately, what it does is it creates an inflammatory reaction. Well, if you hit your finger with a hammer, you know what an inflammatory reaction looks like. It means your finger swells up, it's red, it's throbbing and pounding, and it hurts like crazy. That's your body doing that. That's your body's immune response coming to action and doing its job. We want that. The problem is these cavitation areas, it can never heal it. It can never fix it because it's dead, necrotic, gangrenous tissue. It never can fix it. So all the guys with the machine guns come in, but they never leave. So they create this inflammatory reaction in the body that creates all sorts of issues all throughout the entire body from an inflammatory standpoint, and it never stops. That's why cavitations are problematic, because they never go away. So this is why we want to clean them out so that they can finally, your body can say, okay, I can quit doing this. I can quit fighting all the time. Do you floss before or after using your tooth powder? Also, how long should we wait to use mouth rinse after your tooth powder? So I like to floss after, because you can drive then the hydroxyapatite between the teeth. And if you're using my mouthwash, you can use it right away because it also has hydroxyapatite. If you're not using mine that has hydroxyapatite in it, I would wait like 20 minutes or so before using another one. Are any implants truly safe, or are there risks with any foreign objects screwed into the body? I'm dealing with a recurrence of breast cancer. Despite hating not replacing these teeth, I don't want to jeopardize my health or immune system further. Obviously with good concern. Ceramic dental implants have shown exceptional basically, the body accepts them. It says, I like this. I like this material. We're not seeing infection around them. We're not seeing inflammation around them. In fact, it's crazy. If the bone doesn't grow to them, if they quote unquote fail, they just sit there. Sometimes we'll look at them, we're like, I think that one didn't integrate, but it's not even red. You would never know it because the body is just so accepting of them. But obviously, you're the one who has to decide for you. I always tell people, I'm going to tell you what I would want to know if this were my head and my mouth, but it's yours. So you get to decide what you're going to do. So would I put a ceramic implant in my mouth? Absolutely, 1,000 times over, but you need to decide what's best for you. All right, I'm going to see if I can, there's a couple more. I'm going to go fast. I had a crown done on a small molar 2 years ago. My new dentist suspects there's decay and wants to redo the crown. An x-ray doesn't really tell us for sure, and I have braces, and I can't should I redo the crown? Or he wants to make the crown wider and bring it closer to the gum line. Well, and maybe if you're in braces, that the best option at this moment would just be to do a temporary filling along in the area and cover over, clean out any decay, cover it over, temporize it, do it temporarily to get you through braces until you can really see. Is there any impact to teeth and gum health for CPAP users? Yes, there is, because it's drying out the mouth. And when you dry out the mouth, bacteria go nuts. So it's not good for that reason. It also puts a lot of pressure backward, and we start to see joint and ear problems because it's putting a lot of pressure to push that joint back into this ear canal. So yeah, you're going to want to be really careful. Make sure you use the hydroxyapatite tooth powder before you're going to bed to protect the teeth. I would use the breath spray or the mouth rinse too, and get everything really moist before you put that on there. See if that'll help. I can't see the gut test. Did you see it was say it was on Total Care Dental site? No, it's going to be on the Living Well site. So go to livingwell.drmichelle.com and you'll find the gut stuff. Any natural products to remove tartar? Well, tartar is usually because you're vitamin D3 and K2 deficient. So start there, get it scraped off at the dentist office, and then you can usually keep it off if you're keeping your vitamin D and K levels up like they should be. Can metal retainers cause sinus polyps? I've not seen sinus polyps from metal retainers. I don't like them because they don't allow good bone movement here in the skull, and which is actually something we do need, interestingly enough. So I don't love them, but I've never seen them cause a sinus polyp. I'm having a root canal tooth pulled, number 14. What is the best option after? A bridge. Actually, I don't love bridges because bridges put a lot of force and pressure on the teeth holding that bridge in place, and you often lose the tooth that's holding the bridge down the road. So I much prefer a dental implant. What causes our teeth to turn brown on the back of the teeth, and how can I take care of it? Interesting. That's probably stain-based. So I would start doing the mouthwash. See if you can't balance the biome a little bit, and then watch for the new toothpaste that I have coming up that's going to have probiotics in it, because it's going to balance the bugs. Most likely that's a brown stain that's showing up. So you need to balance the bugs. You can also do oil pulling. Oil pulling may help as well. My 8-year-old has yellow teeth. She's using whitening and remineralizing tooth powder for 1 month. How long would it take to see a change? Is there anything else she can do? This is interesting. Exactly what you're doing is awesome, because yellow teeth means that she doesn't have very thick enamel, because enamel should block out the yellow color. So that is going to be the starting point. You also can do commercial whiteners, a dental whitener that you get from a dental office. Use it for a couple of times and then hit it with the remineralizing tooth powder again. So just kind of keep going through this. All right, I've got to get off. Thank you so much for all of the questions today. Oh, I'm going to answer this last one because it's a quick one. I started mouth taping at night. Do I recommend it? Yes, I absolutely do recommend it if you have struggles keeping your mouth closed at night, because there's so many benefits from nose breathing. So absolutely. Okay, thank you all for being on here. We'll keep doing this every single week. Keep bringing your questions. Love it.